A strained voice called out through the darkened theater. "Please, is there a doctor in the house?" Several men stood up as the lights came on. An older lady pulled her daughter to stand next to her. "Good. Are any of you doctors single in interest in dating with a nice Jewish girl?" A minister delivered a sermon in about 10 minutes one Sunday morning, which was about half the usual length of his sermons. He explained, "I regret to inform you that my dog, who is very fond of eating paper, ate a portion of my sermon, which I was unable to deliver this morning." After the service, a visitor from another church shook hands with the preacher and said, "Reverend, if that dog of yours has any pups, I want to give one to my minister." Now, as a pediatrician, I have had a lot of fun interacting with children. As always, children talking with doctors can lead to some memorable experiences. Like the time 15 years ago when we were just starting to use electronic thermometers. A little boy asked, "Am I cooked yet?" Just after her labor started, the patient's husband left the room to get some lunch. Shortly after, the doctor walked in and ruptured the woman's membranes. As the husband returned, the doctor told him, "Well, I think her water is broken." The husband gave him a very strange look and said, "Can that be fixed?" It was very hectic in the unit, and we were late in getting my patient's vitals. My colleague and I hurried out to the community room where most of the patients were. I reached for the patient's arm and started taking his pulses as I looked at the clock on the wall. While counting away, I turned out and found my colleague taking the same man's pulse with his other arm. The look on the patient's face was indescribable. Little else is known about her past history. That was a dictation that said the little else is known about her past history, and it was transcribed. A little elf knows about her past history. A patient entered my office complaining of a non-stop headache and anxiety. My conditioning did not draw any conclusions, so I asked her to disrobe and proceeded to examine her. I discovered on her buttocks a nitroglycerin patch. Somehow her husband's patch for his heart condition had found its way to her body. As a hospital nurse, I assisted a busy gynecologist with the pelvic exam of an elderly woman. The doctor, who had come directly from surgery, still had his scrubs on, complete with hat and a mask. After the exam was completed, the doctor immediately left the room. The woman, who unfortunately was never properly introduced to the doctor, exclaimed, "Who was that masked man?" I was drawing blood in an outpatient's clinic in the Bronx. I called out the first name of the next patient. "Juan." Two men came forward, and I couldn't resist asking, "And which one are you?" The obstetrician on our staff purchased a new inboard boat for the lake. When we asked what was she going to name it, he gave what he thought was the obvious answer. Mr. Period. Our hospital recently instituted a non-smoking policy. Patients and employees alike have to go outside to indulge. During a cold front, I passed a man in the hall who had heavily nicotine-stained fingers complaining,